You're listening to the ATS Breathe Easy podcast, brought to you by the American Thoracic Society.
Welcome to the Breathe Easy podcast. I'm your host, Erika Moseson from Portland, Oregon. This is our series, Things You May Have Missed at ATS 2025. We're here to discuss a networking event we just came from called Strategies to Reduce Pulmonary and Critical Care Practice Emissions. Why don't you introduce yourself?
Hi, Erika. My name is Sunil Kapoor. I'm a pediatric pulmonologist at the Medical College of Georgia in Augusta, Georgia. I've been in ATS multiple times, but the first time in a little while.
Yeah, and you and I were both newcomers to this, I think, over the last few years, starting to recognize, hey, every sector of the economy needs to work to get their own emissions down, and healthcare is no different. Why don't you share a bit about your journey and how you came to be part of this networking center session with me?
Well, happy to. So I've been a practicing pediatric pulmonologist for over 20 years. I started off in the private world and about 3 to 4 years ago came over to the academic side. And over the recent past, just reading a little bit more about the climate impact on respiratory health, and then, to be quite honest, finding out how blind I've been to what we are doing in terms of the healthcare sector, and what our role is, not only to advocate for more changes in terms of that, but also how we can modify our own practice in terms of things. And as a pediatrician, it is particularly near and dear to my heart because of the impact that climate change and warming and climate impacts have on not only acute issues with pediatric respiratory health, but chronic ones, lung development, lung growth. The kids that we're passing over to you as adults, we want to be passing them over in as great a shape as they can be in. And this is one of those ways where we can be just a little bit better.
Absolutely. I think you and I were talking after the session about what you're even seeing with climate change and changes in seasonal allergies no longer being seasonal.
Yeah, again, the benefit of some gray hair is I practiced for a little while, and I've seen changes just in a 20-year time span, where I used to be able to tell families, all right, well, our allergy season is X, and we can maybe take a break in therapies and come back in another season. But now, anyone who lives in a pollen area can attest that those patterns have just changed, and we don't get the break that we used to. And so much of that has to do with change in pollination seasons due to temperature changes, and it has tremendous impact on respiratory health in children.
Absolutely. I think a lot of the times there's this tendency when people are talking about, improving the environment and everything for, people who work in transportation or in energy generation, to feel like, those of us in healthcare are pointing the finger at them. But every sector of our economy has some necessity to it, right? Like, we need transportation to bring us the medicines that we use. And so I think it's only fair that, we as healthcare professionals reduce the, impact of our own practice. And it's been so refreshing to learn how much low-hanging fruit there is and how many things we can do, and also how many healthcare systems are already kind of interested in tackling this. And I learned a lot at our session today. It was interesting to meet somebody who was, working for industry trying to reduce, emissions from their inhalers on their own. It was interesting to hear from, medicine residents who came to the table and said that they were trying to figure out how to get this into their curriculum already. I've been recently started working with our own healthcare system and was able to look at some life cycle analysis that was really helpful, because it can help bring science to, okay, is it better to use a reusable gown or a disposable gown, and actually looking at all the emissions that go into that, and learning that we can actually analyze these things rationally, save money, which is also really great given healthcare costs in America, and reduce our practice emissions. Was anything surprising coming out of your discussion group?
Yeah, I think I won't use the word surprising to start. I think what was reassuring was that the struggles that I feel that I see, I'm not alone in, and that there are other people who are trying to navigate similar sort of questions, and we all feel sometimes that we're on an island, but we're not. And if we can do things like a networking session where we start banding together to share ideas and come up with strategies that can potentially help us all get through the same issues. it was very intriguing to speak to an international provider who has access to a lot of things that we don't have. And some of the defaults that I've made in terms of what delivery system is best for other children, I think I'm a little bit of a product of my own inertia. That I got some experience early on and some wins, and I haven't evolved as much as maybe I should have, and learning from people who have had to, due to systems, adjust and learn how to use different devices, specifically about dry powder devices versus MDIs, I think is it's sort of a wake-up call, and that was really exciting for me.
Did you miss the ATS 2025 International Conference in San Francisco? We've got you covered. With the ATS Conference Highlights Package, you can access inspiring presentations as well as valuable clinical insights from pulmonary, critical care, and sleep sessions. Members get a discount, so become an ATS member or renew your membership to take advantage of these savings. Go to conference.thoracic.org today.
And I think we're learning, regrettably in pulmonary medicine, especially about the outsized climate impact from our metered dose inhalers and our HFAs, which do have, very potent greenhouse gas, chemicals. And we always do what is right for the patient, right? So we're never not going to give the right inhaler for the right patient, and certainly not going to have our patients who are already afflicted by climate change extra burdened by someone not prescribing the best inhaler for them. But it was interesting to learn that, that industry is trying to reduce the greenhouse gas emissions. Hopefully that will come to fruition. But I also was just thinking over and over again of the common refrain that we hear of reduce, reuse and recycle. And so, what we really want to do is reduce the need for inhalers, right? So, helping with not having, that's where addressing climate change as a root cause is not having so many allergies, not having so much air pollution, not having so many heat events, which is so hard on our asthmatic patients. And also so that they're not needing as much, having good clean air in the home. So, I think sometimes we're focused very much on the device and we want to give the right device to the right patient, but how can we also just make sure that they don't need as much of that device is also part of doing sustainable healthcare, and it's also just better for everyone's health.
I couldn't agree more with you. In pediatrics, we always focus on prevention, and growth and development is sort of core to who we are. And when you think about prescribing inhalers or respiratory disease, so much of it can be modified at the get-go. I mean, one of the things with climate impacts, which is really significant, is an increase in premature deliveries. So once you already start with that, just think about if we decrease that, the neurodevelopmental benefit, the cognitive benefit, the respiratory benefit, the burden on the healthcare system, all those things from just premature birth could be so much different. And I'll tell you, the patient population that I see, we're seeing more and more kids born earlier and earlier and earlier, and neonatology does a great job of saving these babies. But the healthcare burdens that we are now doing, the problems that we're seeing in terms of young children, is just going up, and it's harder to get a handle on that. Nutrition, air quality, all these things are so important in terms of overall health, and it's really just not so much of a focus as much as it should be.
Yeah, absolutely. I was also just struck by how much of, being mindful of your own practice emissions really dovetails nicely with the Choosing Wisely campaign. In the intensive care unit, we're always trying to balance the less is more, right? So you don't want to be just putting central lines in every single person who needs pressors for a little bit, right? Because then you're exposing them to the risk of these procedures, and putting plastics in their bloodstream all the way down into their vessels around their heart for just a few hours of pressors, which, our anesthesia colleagues have been doing for hours in the, OR just fine through a peripheral IV. So we're starting to recognize, not putting Foley catheters in, doing our best to not intubate patients, being mindful of how many drugs and meds we're giving them. Actually, all of that not only reduces emissions, it's also just good patient care. So it's also kind of encouraging to realize that we can reduce our practice emissions just by being good doctors.
And I think looking critically at what we do, and again, I'll say it again in terms of just, I think oftentimes we are creatures of inertia, and we follow into practice patterns that we don't look critically at. And I'll say I'm guilty of that when it comes to this space. But again, it's these sort of reawakenings that allow us to change and refocus. And I think we have to evolve in how we practice medicine. not only is it better for the planet, it's better for our patients. And
Absolutely.
that's really where it comes down to. Because again, I've been practicing for a little while, and I always tell residents and medical students that, at the end of the day, with all this stuff going on in medicine and all this stuff going on in healthcare, but at the end of the day, when I put my head down at night, I can say, I helped a kid breathe better today. And that doesn't suck.
No, that's great. And it's like, again, I think people just get paralyzed by the scale and the scope of the problem. But, if everybody just does their part,
like your corner.
Yeah, exactly. Better is good.
Better is good.
And one of the things that I'm really excited about is the American Thoracic Society actually has a whole workshop report coming out that's going to, dive deeply. And I was honored to be able to participate in that whole project into, the practice emissions that we generate as pulmonary and critical care physicians. So of course we will be highlighting that on the Breathe Easy podcast when it's available. And in the meantime, what are top three things that you think a pediatric pulmonologist can do?
Yeah, I think a couple things. I think the first thing I would say is rethink about how we practice. Rethink our default that X kid can't do Y therapy. We have to customize what we do for each child and assess them individually. And yes, there are some children who cannot do a dry powder device, but there are some who can. And looking at that critically is one thing. I think another thing that I think we need is communicate better. I think we need to get out of our silos and start thinking about how we can impact things as a community, because one voice isn't very strong, but working collaboratively together, I think that is a major strength of ours. And I think the last thing that we need to do, and I would just say, really focus on what are we leaving for our children. Kids are outside running, playing. They're inheriting what we do, and putting them as a priority rather than as a secondary factor is the number one thing that I would say benefit all of us.
Absolutely. Well, thank you very much for your time, and thank you for contributing and practicing pulmonary medicine and being a pediatrician, because as the mother of 3 kids, I love our pediatricians and we need more of you. And so thank you for all you do.
Well, thank you. Thank you. It was a pleasure getting to know you better and being a part of this session.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.